So like everything that you were saying about, it allows me to go out or communicate with loved ones or, enjoy this and that. And I think that's the key thing with medical cannabis is that it's a symptom reliever. So what you should be doing with it is you should be taking it. You should be enough to relieve your symptoms so that then you can go out and you can engage with the things that are going to give you much more long lasting improvements in your mental health and your well-being.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined today by, well, a returning guest, Dr. Luisa Searle, who's actually going to speak a little bit about psychiatry and the impact that prescribing medical cannabis has had in her experience around this. I know you've done an introduction before, Louisa, but if you want to do another quick introduction, please.
So, hi everybody, my name is Dr. Luisa Searle. I'm a consultant psychiatrist dealing with adults with mental health issues. Have been prescribing medical cannabis for about 3 years now. But prior to that, my specialty, and still is my specialty actually, is in addictions and mental health.
Very exciting. And can you let us know a little bit about, I suppose, your experience as a medical cannabis prescriber?
Yeah, so came to medical cannabis by accident, really, just feeling a bit burnt out in the general psychiatry world, and just came to it by accident. And I didn't even realize it was a thing. Like so many of our patients, like so many other medical professionals, they still don't know it's a thing, which is sad, really. And so this clinic was advertising for consultants to come and prescribe for them. So I was like, yeah, let me go and see what's going on here because I, already had anecdotal experience of cannabis, people self-medicating essentially and finding it helpful. So I thought, if I can do something in, a much safer and legal way, this will be hopefully be really positive. And it has turned out to be really, really positive actually because I've never really worked anywhere where what I do makes such a big impact on patients' quality of life. Like, spent, many years using conventional medications and, they have their place and, and they do help. And especially if somebody's, in a complete crisis and needs, some medication, it can help to just pick them up off the floor so that they can actually see the light at the end of the tunnel again and give them some hope and give them the ability to utilize other interventions that can help them. But there was always this sort of sense of either the conventional medications were just not that effective in terms of helping somebody to feel really better and back to like 100%. And sometimes there would be this kind of stripping of their personality, like they would feel okay, but they wouldn't really feel like themselves. They would feel like something was missing from their kind of like personal experience. Or they would feel that their emotions were sort of like dulled. So they weren't depressed anymore, but they weren't also really able to feel joy in the same way. So they were just in this sort of weird sort of limbo place where they're okay, they're not, going to harm themselves, they're able to function, but it was like half a life sort of thing. And so, coming to medical cannabis, it was the first time where I was sort of able to prescribe something where a patient had actually come back and say, I'm feeling so much better. Like, I like one of the beautiful things that was happening was people were saying things like, yeah, I'm engaging with my family, with my partners, I'm actually able to talk to them and like enjoy being around them and laugh and just enjoy life and just what we all deserve as human beings, just to feel comfortable in our skin and be able to interact with our loved ones and be fully engaged in our lives and be present. I think that's just something that's so important. So it was like, wow, what is this substance that finally as a medical professional I can actually do something that actually makes people feel better instead of just keeping them in this like holding position. And that's generally been the experience, not really been able to prescribe something before that can do different things as well, like manage somebody's insomnia, but also help their mood, or help their anxiety, or just calm their intrusive thoughts and like negative thinking. And I almost feel like medical cannabis is like giving somebody a shot of CBT. So cognitive behavioral therapy tries to get you to examine your kind of like negative thought processes, if you like, and help you think about them in a different way. And it's like cannabis just does that, like a shot to the head. Like it's like, this is the problem that I'm thinking about, worrying about, stressing over. And then you take some medical cannabis and it's like, oh, okay, maybe it's not quite as frantic and as bad as I thought it was. And actually, I can think about it in a new way that helps me feel less distressed by it. And just, so many patients come back and, they say, I'll take my medical cannabis. And I don't know what I was stressing about. Like it suddenly brings it into a new focus and a new light that they can deal with. And it's like it stops them worrying about the past, which you can't really do anything about. It's gone, it's over. Like there's more acceptance of it, and then helps them to stop worrying about the future so much, so that they can actually just like be in the moment and enjoy their kind of present space essentially. And whether that is just enjoying my present space in terms of whatever I want to be engaged with and do, like my hobbies, my exercise, what I watch on TV, what I read. Like you can actually just be present and focus on it and actually enjoy it, instead of all this crud in your head essentially just chattering away all the time. And it's just been so wonderful, to see patients feel like that, or just for them to come back and say, I actually slept. Like the impact of just having a decent night's sleep just cannot be expressed enough. Like you get a good night's sleep, everything else is just so much easier to deal with. So just being able to like sleep properly for the first time, even if they just get a solid 4 hours or 6 hours, but just actually getting a solid chunk of sleep instead of waking up every hour, half an hour, or not being able to get to sleep at all. So by the time you get to sleep, you've got to wake up in a couple of hours and then you're just exhausted, and it just makes your mental health the next day so much, much harder to deal with. So it's just been like really heartwarming, I guess, for me, like just to see people just feeling so much better, and just managing their day-to-day struggles so much better than they were able to do on the conventional medication, and often without some of the really unpleasant side effects that can come along with the conventional medication. And it's not that medical cannabis doesn't have its side effects, because it very much does. It can make your heart race, it can mess with your blood pressure, could make you more anxious, sometimes wrong strains, too much THC, not good for you. So it's not that it's without its risks, but I've never really been able to prescribe a medication that actually like transforms people's well-being. And that's what's so lovely about being in this field.
No, that's amazing. And you touched on something that I think is very important. As a patient myself, not necessarily a psych patient, a pain patient, but it would still, I suppose, be applicable to me in the sense that a lot of the medication that are prescribed for you are sedating medication. And like you said, it does sort of like rip your personality apart because you are constantly sedated. You are not really able to have a single thought process sometimes, and I already struggle. See, I'm slurring my speech as it is. Like, so I already struggle with cognitive issues. And when you add that extra sedation, I mean, it's very, it's very, sorry, you really can. You really can't. And sometimes, especially with opiates, I find myself lying in bed trying to watch TV, and next thing you know, the movie is finished, and I'm sitting there going, "I what? What was that?" Yeah, exactly. So I tend to find that that's really, really important in terms of having the medication that is a lot more effective and enables me to do more things, which is the other thing I wanted to mention because you did touch on it. And again, I can speak from experience. It's amazing to be able to have a life again. Whether it's mental health or physical health, a lot of people do not realize the impact that it has on your overall quality of life. And yeah, and where you have this medication that actually enables you to be able to actually see my friends on a regular basis, be able to even just talk on the phone to people, it makes a world of difference, especially with people. I think when we're talking about mental health, depression, when somebody is depressed, they don't want to communicate with loved ones. I tend to find it's because they struggle to have to explain that actually I'm not in a really good place, and so would rather just keep to themselves, and self isolating just fuels the depression even more because then you're left in this position where you feel like, well, no one cares. Well, actually, you haven't reached out to anybody, you haven't spoken to anybody, so yeah, exactly. But then, depression is this thing that just tricks you into thinking that, yeah, yeah. I always, whenever,
I call it a little gremlin. Like it sits on your shoulder, just feeding you crap. Like, sorry to swear, but like it does. Like depression is just like this horrible little gremlin. It sits on your shoulder and it just feeds you rubbish. You're not good enough. You're worthless. Nobody cares about you. Like, and it just sits there chattering away. And it's really hard to like tell it to bugger off. Basically, like it's really, really hard. Medical cannabis, I think, gives you that ability, that space to be like, no, people do care about me. I've got this evidence, I've got that evidence. This person, actually, the reason that nobody's contacting me to find out how, because nobody knows that I'm suffering because I'm so good at like masking it and keeping it, to myself. But actually, who actually knows that I'm suffering? And maybe I should reach out. And I think from what you're saying, I think that also touches on a really key point. So, like everything that you were saying about, it allows me to go out or communicate with loved ones or, enjoy this and that. And I think that's the key thing with medical cannabis is that it's a symptom reliever. So, what you should be doing with it is you should be taking it. You should be enough to relieve your symptoms so that then you can go out and you can engage with the things that are going to give you much more long lasting improvements in your mental health and your well being. So, whether that's giving you the opportunity, as you've just said, to communicate with others, to socialize, to meet up with your friends, which is so important for our emotional well being, that's exactly what the medical cannabis is for. You should not be taking medical cannabis and then just sitting in your house by yourself. You should absolutely be using it as a tool and a stepping stone to engage in whatever it is that you need to help you. So, whether that's helping you get out to the gym, because exercise is fantastic for mental health disorders and pain disorders as well, actually, for basically everything. like, so, or if it helps you actually get to the therapy sessions that you've not been able to get to, you've been struggling to get to because of anxiety, like those are the things it should be helping you to do. If it's helping you to just get out of the house so that you can go shopping, so that you can buy healthier food for yourself instead of just relying on either not eating properly, or not eating much at all, or just eating the wrong things because they're convenient and you can't be, your depression is making it really difficult for you to be able to cook and just think about what you want to make to eat. So it, think about it like that. That's what I really want to stress to people is that it doesn't cure the depression, it doesn't cure the anxiety, but it reduces or lessens your symptoms to a point such that you can then engage with the other things that are going to improve your quality of life. And if it's not doing that, and if you are not doing that as a patient, you need to seriously consider whether you should continue medical cannabis, or that you need to think about bringing those things into your life that are going to improve your quality of life. No patient should just be taking medical cannabis, and then that's it. Like it's not the whole answer. It's not the whole solution.
I fully agree and I echo that. It's something that I scream from every single rooftop is that my because I do have an autoimmune disease, I still have to have treatment for that. But in the past, I would not be able to even attend appointments, and so I was in this vicious cycle of not being able to go to my appointment, and then not getting any better, and then them discharging me as a result of me not being able to engage, and then you have to go through the cycle of fighting them all over again to get back on the waiting list to not be able to attend appointments, and repeat. And so one of the things that I mean, for myself, I always say to people, even when I'm dealing with patients' complaints, and a lot of the times, patients, the main thing they complain about is when there's a shortage, and they're like, "Well, how is it going to impact me?" And I say to them that medical cannabis shouldn't be the only thing that you are relying on in order to feel better. It should be a part of a holistic approach. And I explained to them my routine, like, and yes, it is exhausting, which is the reason why people just think, okay, well, I've got the medication, I feel better, I'm not going to bother doing all the other stuff. But the thing that they don't realize is by not doing that, they're not actually allowing them to feel so much better, because you actually can. Like, I know when I first started, I felt terrible. And then did all the stuff like physio appointments, all, you name it. And I started realizing that even without my medication, I wasn't critical until a certain point. Like, once you reach about 10 days with no medication in my system, then yeah, that's it. But
But it's like you had basically, because you had brought in other techniques, that support would support you until you were able to get the medical cannabis again. What you're saying is your health, your physical or your mental health, shouldn't drop off a cliff just because you don't have the medical cannabis. That kind of, in some circumstances, not all, but in some circumstances, that's kind of suggestive of psychological dependence. That if you don't have a certain substance, you just immediately just deteriorate and just drop off a cliff, and you can't manage and you can't cope. It shouldn't be the only thing that you rely on. And it's a real testament, to your, like, belief in all of these different things that you do to try to support your physical health, that just demonstrates perfectly that if you do these other things as well, it shouldn't cause, a massive relapse in you, and for a short period, because you're doing so much else to support your physical and your mental health.
exactly. And even when you do have the medication, you do all that stuff, people don't realize that you can actually feel so much better than you already feel. And I get it. When you're feeling really, really horrible and you finally find a medication that has worked for you, and you spend a lot of the time, sadly, years trying to live out, you're tired. I get it. You're like, I don't want to do any more work. The medication is working. Let me go live my life. But unfortunately, like, you mentioned, it's a symptom reliever. So it's working to relieve symptoms, but you still need to treat the condition. And so I always feel it's important to not completely exclude the NHS and on all of the support that they offer, because yes, they still offer therapy. You can, like you mentioned now, you can go and do therapy. You can see your friends, you can go to the gym. Like, these things are so crucial in improving your well-being. And I know for myself that I've now reached a point where I'm going down on my medication, so I'm saving cost as well, because I'm not sure if I'm legally allowed to say how many grams I was on, so I'm not going to say anything, but basically I was on a much higher dose.
Essentially, because the essentially what you're saying is because the medical cannabis gave you that symptom relief, so then you were able to fully engage properly with the other interventions that were asked of you, or that were prescribed to you, so that your physical health has now improved, so that you can actually use less of the medical cannabis because you're not so sick anymore, because you've done this other work essentially to improve your well-being and your physical health.
Yeah, no, it's spot on. Thank you very much. And yes, and yeah, sorry. So just on the topic of, I suppose, psychiatry and medical cannabis, one of the, I think, the key things that people want to understand is, I think you already touched on the psychological dependency. Sorry, yes, sorry, conditions and exclusion criteria. Sorry, thank you. I'll cut that. Yeah.
Right. So, so we touched on the exclusion criteria in the last podcast, but I'll just run over them quickly again. So, essentially, medical cannabis, we're still sort of like trying to understand the potential risk factors for like mental health. But one of them that we are almost certain on is that potentially medical cannabis could cause what we call psychotic disorders. So these are things like schizophrenia, mania with psychosis, delusional disorders, even transient psychotic illnesses that cause like hallucinations and hearing voices, seeing things that other people can't see, these kinds of things. So there is often an exclusion if if you have unfortunately got any of these types of diagnoses where the mental illness causes you to be detached from reality, then medical cannabis unfortunately is not for you. Similarly, on the physical health side, it tends to be cardiac related, so heart related, and vascular related, so related to your blood vessels. And that can mean things like if you've had a stroke, so where one of your blood vessels potentially has burst in your head, or a clot has formed and blocked some of the blood vessels. These types of conditions, like if you've had a heart attack recently or you've got unstable heart failure, then these types of conditions can also mean that medical cannabis is not safe for you because of the effects that they can have on things like your blood pressure, your heart rate, that kind of thing. So, unfortunately, for these types of patients, we might not be able to prescribe them medical cannabis, but generally, it's tolerated well. Generally, the side effect profile compared to other types of medications that treat mental health, that treat pain, for example, the side effect profile is often better tolerated by patients, but there are side effects that people need to be aware of, like the increased heart rate, like sometimes worsening of anxiety, making you feel sedated, affecting your motor coordination. There's lots of like potential side effects that people can experience, but if you tolerate it, then people often tolerate it well. And the types of mental health disorders that I commonly see, obviously, number one is anxiety, PTSD. Oh, PTSD, not fun. Don't do that again. Basically, what the hell was that? Just keep my hands down here. PTSD, depression, insomnia, but as part of one of those types of disorders. So I can't treat primary sleep disorders. So if your sleep disorder is not as a result of a mental health issue, that's a different specialty. So I can't treat you for primary insomnia. But if it's part of your anxiety, let's say, can absolutely help you with it. Um, then I have quite a lot of patients, actually, people with autism, where they also struggle with things like anxiety and depression, but they also struggle with like sensory overload and the kind of energy draining, part of them needing to deal with this kind of like sensory overload or communication management that they kind of feel like they constantly have to do to interact with like um, neurotypical people. So they often can feel quite like mentally drained by having to deal with society basically that is geared towards neurotypical people. And so if they do have something like an autistic meltdown, because they've been struggling with whatever it is they've had to deal with for the day, then the medical cannabis can often help reduce that impact. So instead of taking 3 or 4 days to recover from a certain incident or a meltdown, it might get reduced to a few hours instead. And it can also help with socializing as well, helping them to feel more comfortable in their social interactions. So I see quite a lot of patients with autism that have like a mental health issue. Um, and I would say those are the main ones. Sometimes OCD as well. Um, the medical cannabis can kind of help with some of the intrusive thoughts. Just got to be a little bit careful though with OCD because medical cannabis can be really good at focusing you. And the trouble is if it focuses you on the wrong thing, so something negative, then it can be, you can be hyper focused on that negative, like, thought trail, if you like. However, what I would say is different to, let's say, if somebody with anxiety is, got a sort of negative focus that they're thinking about that's like quite intrusive. The difference is that I think with medical cannabis, if you are stuck on a negative thought pathway, if you are able to notice that you are focused on something unpleasant, it's much, 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 much easier to shift your focus to something else. So if you can shift it to something more positive, whether it's talking to a friend or reading a book or listening to some nice music, it's much easier to shift your focus versus that kind of negative thought spiral that can occur, say, in an anxiety or something like that. So just, I guess that's another like thing for just patients to be aware of, is just the hyper focus that can occur, and just try to be mindful, like what you are focusing on. If you are focusing on something unpleasant while you're using the medical cannabis, you will be able to shift that focus much more easily. And then with things like PTSD, it's so helpful in just like reducing the hypervigilance, reducing the intrusive thoughts. If they have nightmares, and a lot of PTSD patients have nightmares, which means their sleep is just so, not only is it disordered, but it's extremely traumatic because they relive these nightmares in, like, very, very vivid. And one of the really, I guess, the beneficial things in this circumstance is that medical cannabis actually reduces your REM sleep. So the REM sleep is where your eyes are moving back and forth while you're sleeping, and this indicates a period of deeper sleep where you dream. And so the medical cannabis, like, for whatever the mechanism is, it basically reduces that REM sleep period. So you still sleep and you sleep deeply, but you don't dream. And so PTSD patients can often get much better night's sleep without the nightmares and the night terrors, which is really, really helpful. And then
Interesting. I never knew that. That's very interesting because I know with PTSD, some of the patients that I've worked with, they have often felt scared to go to sleep, which I just find so heartbreaking. So that's amazing to know. Thank you.
really is, yeah. And yeah, and just as a small amount, before bed can be really helpful in just lessening that impact. And then with things like depression, it can just help to just stabilize your mood, like, so that you're not constantly feeling like up and down and up and down and up and down, and just reducing intrusive thoughts, and just, again, just allowing you to be like present. And sometimes if you get the right medical cannabis, it can actually boost your mood, and it can give you energy, and it can give you motivation, so that you can get out of the house, you can get up, you can get washed, you can get dressed, you can potter around the house if you like, if going out's a bit too much, but at least you can do things around the house. And sometimes it's those small wins with depression, like I got up today, I got dressed, I made food, I cleaned my room, like those sort of small wins should not be like negated, in things like depression. Just having that ability to just function a bit more normally, so you don't feel so useless. So that bloody gremlin that tells you how rubbish and useless you are just goes away for a bit, and you can actually feel like, okay, I've actually, I've got up today, I've done some things, and just not feel so rubbish, and so negative about yourself, and just your self-esteem, just like help improve that.
No, that's amazing. And you said something really important around making sure you're on the right medication. I think this is really crucial because, like all medication, you do actually need to find the one that works best for you. And sometimes changing it around a little bit does make I have no idea how, but it does sometimes make a huge difference to your lifestyle and well being.
Yeah, it really, really does. And this is where I think it's really important that you identify, again, what are you trying to get out of the treatment? Because, as I said, I think a good clinical medical cannabis clinician will want to understand what it is you are trying to treat with the medical cannabis, because it's very different. So somebody who has, like really high anxiety throughout the day, every day, versus someone with depression, the two types of medical cannabis for those two different disorders are going to be quite different. Like with anxiety, you don't really want to give somebody more energy and more stimulation because they've got enough. They've already like overloaded, in their head with whatever it is. Their body as well can often be in a state of stress and panic. So they're restless, they're restless, they're moving, they've already got enough energy, as it were. So you don't want to give them something that's going to like add to that and kind of like adding petrol onto a fire. Whereas somebody with depression actually who can be quite slowed down, low, if we call it like a low energy disorder, um, you that bit of a lift, that bit of energy, that bit of motivation can be really good in that circumstance. So it's really important to, I think, to identify what are your symptoms, what are the ones that you're really struggling with, and you know most of my patients will go through it, will be commonly, it'll be things like, well, it's insomnia, and oh god, I need to like comes out of nowhere. So it will be things like insomnia. If it's mood, it's often to just like regulate the mood. So they don't necessarily think that the medical cannabis is going to make them, feel, 100, completely solve their depression, but at least just regulate the mood. So it's less up and down, so that you feel less like under control, I guess, by your emotions. You feel a bit more like you're in control of them. If it's anxiety, obviously it can be things like, I want to reduce the intrusive thoughts that I have. I want to be like worrying less about things. So, dependent on what the patient wants to target and whether that is realistic. So, obviously, if the patient's target is to, I want it to cure my depression and I want to just, never feel depressed again, that's not realistic. Like, unfortunately, I don't think we're there yet with any type of medication that can completely like cure depression. But if it's to relieve their symptoms, like we said before, so that they can function better, that's absolutely achievable. Like we can absolutely do something about that, and we can utilize different types of medical cannabis to target those specific goals.
Is amazing. So yeah, I think that actually brings us to an end. Thank you so much for coming on today and for your amazing insight. Even though I've worked in the sector and I am a medical cannabis patient myself, I actually learned a lot that I wasn't even aware of. So that's really interesting. Like, oh no, I love that. So that's very interesting. But thank you so much for joining us. And um, apologies, guys, my throat. And I look forward to seeing everyone next week where we're going to look at some more patient experiences. Thanks.
Pleasure.